kitchen, you guys. We're gonna do a cervical mucus demonstration. So we're gonna go through the different types that you might be seeing and exactly what they mean. So we're gonna go through the dry, the EL, and the ES mucus. So starting off with the dry mucus, you could see this after menstruation and then also after you ovulate. So when that progesterone is rising, that means we are creating that thick, dense cervical mucus. So then that's going to plug the cervix, and you might not see anything at all. So when you wipe, you could just get like a little bit of shininess and it quickly dissipates. Or it's also possible to get this kind of tacky cervical mucus. Usually this would be a little bit of the G mucus plug, or it could be like cellular slough just from like your vagina's cleaning mechanism. So that is something similar to what you might be seeing. Also notice that it's not moist. You have no moist feeling. It's definitely not stretchy. It's not clear, and it's definitely not lubricative. So that would be a good example of a dry day. Now, another example of a dry day is just a slight wetness or shininess on your hand. And again, if you just kind of let it like rest in the air, it's going to quickly dissipate. Over time, you will notice the difference between when you are fertile and when you are not fertile. And really the different mucus observations that you are going to notice is going to be different from another person. But in general, this is what it is like. So oftentimes when we go from our period to dry days, eventually we escalate to our fertile window, which we notice this creamy or like lotiony type of cervical mucus. And again, it is possible to go right from your period right into the fertile window, and sometimes your mucus can even overlap your period. So you really need to be paying attention if you have a short cycle especially. And even if you have regular cycles, it is possible for your cycle to change every once in a while just due to like stress and different things. So if you have a regular cycle, it could become short randomly one time. And then also if you have a regular cycle, it could be longer sometimes, like maybe ovulation was delayed. So it's really important to chart down exactly what you see. If you've been charting for a little bit and you keep having these regular cycles, and let's say it's right like the day after your period, usually you're dry, but you see this like lotiony type, or you see an E. coli type of mucus, you need to write that down and you need to treat it as a fertile day, even though it's not usually a fertile day for you, because it's definitely possible for your cycle to shorten. I've had cycles where I ovulate mad early compared to regular ones, and I'm glad that I followed my body's biomarkers and what it was telling me, so I didn't have accidental intercourse on that day. So when you're wiping, or if you put clean fingers down there, you could notice this like lotiony type of cervical mucus. So it is white, so it's opaque, it's not clear or stretchy, but it is lubricative. So this would be considered fertile mucus. And then you can also see this type of mucus with extra fluids. It's still white and opaque, but it's really mixed with like some clear fluid stuff as well. So this would definitely be fertile as well. And also note that some people will refer to mucus as like not as fertile or like more fertile. And sometimes we use the terms like peak mucus and non-peak mucus. So even if you're seeing like this type and it's not that hallmark, clear, stretchy, lubricative, this can definitely still get you pregnant, and this is still considered fertile. There's not really a more fertile or less fertile type of mucus, because you can't be more or less pregnant, as Lisa Hendrickson Jack likes to say. Now, as we progress through our fertile window, you can get a stretchy mucus that is still like white. So this one stretches a little bit, but it's not stretching that much. So let's just say that is stretching quite a bit, just because my products here aren't really working that great. So if it is white and it's stretchy, because it is stretchy, it's considered ES mucus. Remember that the signs of ES mucus are stretchy, clear, or lubricative. So any one of those, that would be classified as ES mucus. Now when we're classifying EL mucus, you might just feel a bit more moist down there than usual. So remember, we're not really looking for anything like physical, but you just feel moist. Because remember, during our dry days, we have that dry, so you might see a little bit of something, but it is dry. It's not moist like you're feeling when your estrogen is starting to rise, so that would be the difference between dry days and moist days. Now, as we progress through our fertile window, you could see that clear, stretchy, lubricative type cervical mucus. This is like your classic egg white mucus, so it is stretchy. My product isn't stretching that well, but you could get a stretch up to about that far, and it doesn't break. That's kind of like a hallmark of like the clear egg white stretchy mucus. So you could see mucus like that. See how it's like stretching. And then again, yours can stretch even further and it doesn't generally break. So that would be considered that ES mucus. So even if this was white and it's stretching, it's still stretching, so it's ES mucus. Again, like we saw with the lotiony type, it wasn't stretchy or clear, but it was lubricative, so it's still ES mucus. Now, another type of like cervical mucus that isn't really talked about that much is like this like super watery type. So you might be the type of person that doesn't get a lot of stretchy mucus, or maybe like you skip over it, you don't really notice it, but you have these really fluid days where like you feel kind of these gushes coming out, that is still highly fertile and represents high estrogen. Now, the amount of cervical mucus that you get personally is going to differ from anybody else. So some women get a lot of cervical mucus, some women just get a little bit. So this is really going to differ per person. And again, the best way to learn is just to start charting. So just get in the habit of checking, check before you go to the bathroom, after a bowel movement, you could check again throughout the day when you're walking around, just notice how you feel and then chart the most estrogenic sign you see at the end of the day. Chart as best you can, just start to notice like the different mucus you're seeing. If you really want to, you could take pictures. Some people find that helpful. And if you find this overwhelming, just chart like the sensation to start. Chart if you're feeling moist. Then you can start charting like different physical things that you see because that's going to be the best way you can learn. So mucus to watch out for, if you have any like pretty yellow mucus, green, gray, if you're getting that cottage cheese type mucus, this could be a sign that you have a vaginal infection. So please get that checked out as well. Another great resource is cervicalmucus.org. This lovely lady has put up a bunch of different pictures and videos about different cervical mucus. And if you really want to, you can submit your own. So this kind of just helps you identify what you're looking for in the different types. So that can be helpful for you as well. As always, if you have any questions, post them in the community. If you want me to go over any of these further, just let me know. If you see these, you need to be using protection if you do not want to get pregnant. And if you do want to get pregnant, now is your time. We're going to go over some mucus types that would be considered fertile for you. Now, first up, we see this lotiony type. Now, this isn't considered peak mucus, but it's still fertile because it is lubricative. It's not clear or stretchy, but it's lubricative and it's giving us that moist sensation. This can get you pregnant. A lot of times you might see a really fluid mucus mixed with the white, which kind of looks like that, like you've seen in my other videos. And that can occur as the rising estrogen is leading you towards ovulation. This is considered fertile. Now, as we progress through our cycle and our estrogen is rising, as that follicle grows, we're gonna get a more clear cervical mucus. So it's lubricative, it's clear. It stretches a little bit, but it's not really stretching that much. This one would be considered fertile as well. As we get closer, we're nearing ovulation, you can get that egg white, stretchy, clear, and lubricative type cervical mucus. This one is very common. Now, some women get a ton, some women just get a little bit. This is considered fertile. Another option is you can get that stretchy mucus, but it could be white. Maybe it's not really clear for you. Maybe it's a mixture of clear and white, but this is still considered fertile because it's stretching. The other option, and a less known one, is this really watery like cervical mucus. Now, you could have that mixed with either the stretchy egg white or more of the white opaque mucus. And this one is suggesting really high estrogen, and it could just be watery for a lot of ladies. Might not get that stretchy sensation. You could skip over it, or maybe you just don't notice it. This is considered fertile. So we covered the different types of discharge that you might be seeing. So when you're deciding between our fertile and infertile days, we look at our cervical mucus. So we went over in the other video the different types of fertile mucus that you could see. So if you're not trying to get pregnant, you would use protection or abstain there. And then if you are trying to get pregnant, that is your time. So the days that you would be deemed like infertile will be our dry days. And this can look different person to person. In general, you are feeling dry. You're not always gonna feel super dry down there. It is a mucous membrane, remember, so it's gonna have a little bit of something. So if you were to have clean hands and insert, you're going to get something, and that's why we prefer external checks. So after your period, you can get a handful of dry days before your body starts to make that cervical mucus as your estrogen rises. And what this looks like, again, it's gonna be different per person. You might have this like dry, tacky discharge, and notice how it's not clear, definitely not stretching, it's certainly not lubricative. So this has like not much moisture to it. If you rub your fingers together, it kind of balls up, and it's definitely dry. And again, we're not having that moist sensation down there. It also might just look like that, just like a little something. And what that little something could be is like cellular slough from your cleaning mechanism. It also could be G mucus from the residual progesterone from your last cycle as well. Another thing you might see on a dry day is just a little bit of like moisture. But really the air is quickly dissipating it. It's not lubricative at all, because remember, it's a mucous membrane, so you might get a little bit of like wetness. You might not feel completely dry, that's completely normal. So you might just get a little bit of like shiny or like wetness on your finger. And then with your toilet paper, when you wipe, you could see a little shiny spot, and that can be completely normal as well. It can take some time to kind of dictate between a dry day and your fertile mucus days, but with practice and over time, you will get the hang of it. Just take your time with it. Maybe just look for like sensation, get in the habit of checking. And you can move into charting like different things you see, whether it's like lotiony, lubricative, if it's clear or stretchy, or if you're getting those dry days. It can really speed up the process and make you feel a bit more confident if you do work with a fertility awareness instructor or if you take a course. I do have a free FAMWISE guide in my bio, so you can check that out, and I have a course launching soon as well, which I'm super excited for, so stay tuned for that. And you've made it to the end of the lesson, so I hope that video was helpful in helping you determine exactly what you're looking for when you're looking at your mucus and how to do that, how to chart. The homework for you guys today is to just start charting, and if you feel overwhelmed or confused, this is a very normal stage, and nobody learns just by reading a book or watching a video. You'll really learn just by doing. So just start by getting to the habit of checking for cervical mucus, and then you can determine the sensation, and then eventually determine the differences that you can see in these mucus observations, and then come back and watch this video again, and you'll see that you'll have a better understanding of like the content. And that is it for this lesson. In the next one, we're going to be covering the phases of the cycle.